Chandran sir, good evening.
Good evening.
Good evening, Chandran sir.
Good evening.
Yeah.
Hi,
Hello?
Alex.
Right, it's 7 o'clock now.
Yes, sir, we can start.
Dr.
Avni,
Judy and
ma'am.
Dr. Avni, please start.
So directly start now, sir.
Yep.
Yeah. Good evening, one and all. I, Dr. Avni Skandhan,
and myself, Dr. Judy Mary Kurian,
welcome you all to the first celebration of the International Day of Radiology organized by IRIA Kerala.
The International Day of Radiology is an annual event held with the aim of building greater awareness of the value that radiology contributes to safe patient care and improving understanding of the vital radiologist role and radiological technologists play in the healthcare continuum. Medical imaging is one of the most exciting and progressive disciplines in healthcare and a field of great activity in terms of technological and biological research, such as X-rays, MRI scans, ultrasound, and numerous other medical imaging technologies, as well as the eye-catching images associated with them, are known to many people, but the exact purpose and value of these services is not widely understood. We therefore chose November 8th, the day that William Conrad Röntgen discovered the existence of X-rays in 1895 as a day of action and awareness.
In 2021, the International Day of Radiology has been dedicated to interventional radiology and its essential role in treating patients. As the world continues to face the challenges posed by COVID-19, it is extremely important to acknowledge the key role that medical imaging has in medicine, not only during unforeseen circumstances such as the pandemic, but also on a daily basis in all areas of patient care. Interventional radiology is a unique and growing subspecialty that helps and protects patients each and every day. The motto this year is Interventional Radiology, Active Care for the Patient.
With this, we will move on to the function, which includes several luminaries who are very senior radiologists, as well as doyens in the field. Now, I'm extremely proud to invite our state president, Dr. M.C.J. Prakash sir, for his presidential address. Over to you, sir.
Good evening, Rao sir, Devi Mandalam sir, and the distinguished array of guests and program managers and my dear friends and colleagues. I am really very happy to preside over this August function celebrated along with the International Day of Radiology. The theme, as the MCs already described, it's interventional radiology. The theme, which is highly relevant in the current scenario, where the radiologists are becoming the physicians and the curers and coming to the forefront rather than sitting behind the screen and giving just a simple diagnosis. We are very lucky to have the doyens of interventional radiology, world-renowned pioneers, Vadula Rajinikanth Rao sir and Ravi Mandalam sir. We are blessed with their solemn presence and the encouragement they impart to us and to the generation next. Thank you, sirs. We are very overwhelmed by your presence. And I am just going to say a few words, or rather introduce the distinguished radiologists, our senior leaders in the profession, who are our teachers, and they are being honored on this occasion for ethical practice and giving proper guidance to the radiologist. That's the generation next. First, I call upon Dr. Alex Ittiyavirah sir. He is known to everybody. He is being honored on this occasion. And next comes our dear Chandran sir from Trichur. He is a doyen in the conventional radiology arena. He has been doing yeoman service and teaching young radiologists in the pursuit of conventional radiology and diagnostic procedures. Thank you, sir, for coming. Then we have our Ramachandran sir, who was the leading light of RCC, who trained so many radiologists, young radiologists, and all also. He is a very senior guy. Thank you, sir, for coming. We are also expecting Pavithran sir, Vilapila Kandi Pavithran sir. He is a very well-known figure in our teaching faculty. And in his absence, I welcome him. And all our team, Moorthy sir, Srikanth Moorthy sir, Jayakrishnan sir, Kesavadas sir, we are all leading this great organization to super heights. Thank you for your presence and guidance and help. And not to ignore our Lali madam, she is a senior teacher here, and Jassim, Dr. Judy, Dr. Avni, all are seen in the screen. I am not going to the other people, radiologists, our colleagues and friends, very senior guys who are attending this function online. Thank you all. Welcome, warm welcome. Thank you.
Thank you so much, sir. Next, for the inaugural address, I invite Dr. VRK Rao, sir, who was a professor and head of the department at Sri Chitra Tirunal Institute of Medical Science, was responsible for the birth and growth of interventional radiology there and brought it to national and international limelight. I welcome you, sir.
Thank you. Thank you very much. At the outset, it's a great honor for me and for having called me for this meeting on this August occasion. A very momentous event to cherish, really. And today it's really a very, very appropriate day for us to celebrate this discovery of X-rays. You know, the radiological societies all over the RSNA, ACR, American College of Radiology, and European Radiology, they all have initiated this program some nearly 11 years ago, 12 years ago, and which was originally started 13 years ago, the first one, in fact, and we're continuing it now each and every year. William Conrad Röntgen, he would not have imagined the tremendous impact and the potential of the X-rays he discovered. And standing on his very strong shoulders today, we evolved from the cassettes, then screen radiography to darkroom fluoroscopy, and then eventually to era of computer radiography, magnetic resonance imaging, and even nuclear medicine, PET scanning, so on and so forth. Today, we are all able to watch the images in real time and online. So this is because of the tremendous explosive and exponential growth in technology. For the younger generation, much more difficult for us. It's very difficult to have a dialogue with Kesavadas on neuroimaging today because of his knowledge and his exposure with the experience in day-to-day handling. I wish I could go back into real time. So as a result, there is a sea change in the patient care, in the interventional radiological techniques as well. We are speaking of diagnostic, but imaging also and interventional. And this is because of the training which the interventional radiologist has groomed into that is, be it clinical imaging or intensive care management, pharmacological management with the patient, or then hardware knowledge, then the advanced functional imaging, and also metabolic imaging and molecular imaging techniques, which are essential for a decision making, even for interventional management as well. It's critical, for example, stroke management, just not putting thrombolytic therapy, but one has to have overall knowledge of the entire thing. He should be trained and knowledgeable. Also, we have to be extremely grateful for the development in the field of contrast media, without which it was never complete. The interventional radiologist is an all-rounder, as I was mentioning. With the clinical medicine, he should be aware, he should be fully knowledge, and he should have the knowledge of the other allied specialties. He will be in the same platform for a dialogue with the clinicians to understand and to interpret for an effective patient care as a team member. He is not alone ever. He's a team member. So this meeting is today ideally designed and to share and celebrate the International Day of Radiology and go home enriched with the new experiences and knowledge for the future to come. We're also grateful for the unsung heroes who are behind our growth, our evolution. They are the engineers, the mathematicians, computer scientists, the material scientists, and all the others who have contributed to the evolution of imaging. So as I practiced interventional radiology, before I conclude, I wish that in my career, I must first thank Professor M.S. Valayathan, the director of the institute. Because of his vision, he developed the institution, and that's where I started my career and nurtured my interest in interventional radiology. And we have also, many of you may know, we have documented our travails and tribulations in the narrative of the evolution of interventional radiology in the recent publications in the Journal of Vascular and Interventional Radiology, and the birth and growth of interventional radiology. I shall put it as the birth and growth in Trivandrum. In Trivandrum, as my family, which has born and grown, my son is born there, my daughter is also educated there. So I'm a Keralite basically, and I'm very happy to share this great honor with my colleagues. To name a few, but in particular, Dr. Ravi Mandalam, and several others. There's no time for it now, including those who are technologists, the nursing staff, doctoral technicians, and many others who have contributed to the patient with the great. So thank you very much. Thanks a lot. Thank you.
Thank you, sir. Now I invite a very dynamic person in Kerala radiology, who is not only well known at national level, but also at international level with his hardworking and humble nature. Welcome, Rijo Mathew, sir, for the felicitation.
Thank you, Dr. Judy. Respected President of IRIA Kerala, Dr. MCJ Prakash, sir. The chief guest of the day, Professor Dr. VRK Rao, sir. The winners of the Ethical Practice Awards and the Research and Innovation Awards, and also Dr. Ravi Mandalam, sir, along with Dr. VRK Rao, sir, whom we are honoring today for their contributions to the field of interventional radiology. All the office bearers of IRA Kerala and all the delegates. First of all, let me wish all of you a happy International Day of Radiology. And this year's theme of interventional radiology, I think, will be a part of the future recognition or role of radiologists as a branch of clinical radiology and interventional radiology. So last 40 years, radiology has been called by different names: Department of Radiodiagnosis, Department of Radiology and Imaging, some called it Department of Imagiology. But we need to have some sort of a consensus to bring in the two essential components of radiology, that is clinical and interventional radiology. So the departments, I hope, in the future will be called as departments of clinical and interventional radiology. So I have to thank and I have to mention about the efforts taken by the office bearers of IRIA Kerala to organize this particular event. Coordinators, Dr. Jassim and Dr. Shakti Parvati, both of them are young interventional radiologists from Kerala. And now we can see in Kerala what Rao sir and Ravi Mandalam sir had initiated in Srikanth now has spread to all the parts of all the districts of Kerala. I must say, in both private sectors and government sectors, we can see interventional radiology departments. And many youngsters are now interested and joining interventional radiology. So what a stupendous effort this gentleman has taken years back, and that we are seeing the fruitful years of that efforts now. And years ahead, I am sure interventional radiology will be an integral part of radiology. Though years back, I remember once Dr. Alexander Margulis saying in 1995 that by the year 2020, ultrasound will become the clinician's new stethoscope, and interventional radiology will become a part of surgery. But I think radiologists are resisting that and still making inroads into that and still claiming ownership on this specialty. And I'm sure with the kind of efforts from the youngsters, guided by our doyens of interventional radiology, I think interventional radiology has got a bright future along for the radiologists in this country. With that message, I once again wish each one of you the happy International Day of Radiology, and let us move on to the honoring of the award winners. Thank you very much.
Thank you, sir. To introduce and honor the recipients of the awards for recognition of their contribution to interventional radiology, I invite Professor Dr. Kesavadas, sir, Professor at Sri Chitra Tirunal Institute of Medical Science, and Dr. Jayakrishnan VK, Head of the Department at Aster Medcity, Kochi. Over to you, Kesavadas, sir.
Rao, sir, Ravi, sir, and my dear friends. It is indeed an honor to be speaking about a legend, Professor Vedula Rajnikanth Rao, VRK Rao, fondly called as Rao sir by his students all over the country and abroad. Dr. Rao was born in Andhra Pradesh. He earned his medical degree in 1970 from Andhra Medical College, Visakhapatnam. He spent the next few years getting his post-graduation in radiology from the University of Delhi and Banaras Hindu University. Dr. Rao began his academic career at Sri Chitra Tirunal Institute of Medical Sciences as an assistant professor in 1977. Over the next 17 years, he held many posts at the institute, such as the professor of radiology and head of the Department of Imaging Sciences and Interventional Radiology from 1986 to 1993. Later, he moved to Al Jazeera and Central Hospitals, Abu Dhabi as head of radiology. He came back to India in 2005, working briefly at Kerala Institute of Medical Sciences, Thiruvananthapuram. From 2006 to August 2013, he spent his time at Kasturba Hospital, Manipal, as professor and head of radiology and imaging. Till recently, he was the clinical director of radiology and imaging at the Krishna Institute of Medical Sciences, Hyderabad. Professor Rao earned national and international reputation for his devotion to interventional neuroradiology while teaching at Sri Chitra Tirunal Institute. Dr. Rao established the treatment modality for embolization of brain and spinal vascular lesions, which was not available readily in India. He was inspired by great minds of the time, Professor Luc Picard and Professor Jacques Moret of France, who visited the institute. During those days, that is in early 80s, there was no identified field of interventional neuroradiology in our country. He is not only known for his contribution to the birth and growth of interventional radiology at the institute, he is also known for developing biomaterials for therapeutic endovascular neurointervention. To make treatment affordable to poor patients, he demonstrated the therapeutic usefulness of stainless steel spring coils for intravascular use. At the same time, he did not lose interest in diagnostic radiology. His observations and publications on syringohydromyelia and congenital atlantoaxial dislocation are based on personal experience investigating these patients over more than a decade. His original observations on the integrity of acrylic monomers used for embolotherapy received wide attention. Patient admission in interventional radiology with 2 beds was given by our director, Professor Vellithan, and that was the first time, I think, for an interventional radiology department was getting beds. Today, we are happy to tell that we have in interventional ICU as well as few beds for management of interventional radiology patients, and we have an OPD as well. A subspecialty course was started, that is the PDCC in interventional neuro and vascular radiology, and this was started in 1985. I think this was the first subspecialty training program started in our country. He perused the feasibility of picture archival and communication system, as well as radiology information system related to automation in patient data and report generation. And this is way back in 1990s. So you can see the vision of this man. He perused the feasibility of picture archival and communications. And then from there, he moved to Manipal, where he had the quality improvement program and self-audit in the department function. He was honored for his lifetime achievements by Governor of Tamil Nadu, besides receiving many other accolades by several academic bodies. I was not a direct student of Rao sir, but I am a radiology student who has always been inspired by Rao sir. I am fortunate to have been able to sit in the chair as department head where Rao sir had sat years back. The 3 qualities in Rao sir which strikes me are his passion for the subject, which is unmatched even at this age. Last year, during the peak of the pandemic, he called me one day to ask whether we were seeing neurological manifestation in COVID in our hospital. He had done a literature search of the topic and had a lot to discuss about this topic with me. We wrote a review article as well. While at Sri Chitra, he used to work along with his colleagues late in the evening to plan and develop material for next day's interventional procedures. His enthusiasm was shared by the nursing staff and technologists. They worked even on Sundays and holidays with intense involvement in patient care. He loved sharing his knowledge and experience among fellow professionals and at the same time mentoring students. The second striking point about Sir is his love for his students. Rao Sir is very proud of his students who have become successful in their own fields. He remembers with fondness that they are carrying his legacy to not only different parts of India, but around the world. He always mentions his junior colleagues and students who are leading departments of interventional radiology, especially neurointerventional radiology in reputed and premier institutions like SGPGI Lucknow, Kovai Medical Center, Coimbatore, SRMC Chennai, NIMHANS Bangalore, Aston Medicity Kochi, and Amrita Institute Kochi, and of course, Sri Chitra Tirunal Institute of Medical Sciences. He always encourages his students to achieve greater heights. I still remember the day he called me to congratulate when I got an ICMR award. His pat on my back was more than just an encouragement for me. It was a great feeling of someone who inspired you and who cares and appreciates your work. He considers the accomplishments and recognition of his colleagues and students as his own achievement. No doubt, all his students have a great regard and love for him. The third thing is his attention to detail in every task. Dr. Rao always wanted his students to do a job as perfectly as possible. This was the first lesson I learned from him. As a first-year MD student in radiology at Trivandrum Medical College, we used to go to Sri Chitra Tirunal Institute to discuss cases, especially neuroradiology cases. And I was there discussing a congenital neuro case with Rao sir. He discussed the case and then gave me a special issue of American Journal of Neuroradiology to read and present in the Trivandrum Radiology Club meeting. He even gave me the transparencies for the overhead projection. Those days, we were using overhead projections for presenting. We didn't have the slides. After the presentation, I did not meet sir for the next 2 days, but when the third day I met, he did not smile at me. He was not happy with my presentation. He called me and told me what are the mistakes that I had made in my presentation. The pictures were drawn with poor quality and preparation of the presentation material was incomplete. He taught me an important lesson that is how to present. Rao sir is a great leader and a true pioneer. I am extremely happy to honor him on this day. I bow down in respect to this great influential teacher. I am sure his students would be able to add many more qualities in Professor Rao. I just mentioned few of them. Thank you. Over to you, Jayakrishnan.
Thank you, Keshav. That was very fitting, in a few words about Rao sir, and I've got a tough task to follow, I think. But respected teachers and senior members of IRIA, my dear colleagues and friends in radiology and students, I'm extremely grateful to Kerala IRIA, and I'm feeling very privileged to be here today to give this felicitation in honor of actually for two great contributors to radiology, both Dr. VRK Rao and specifically Professor Ravi Mandalam. Now, of course, Dr. Ravi Mandalam, I don't think he needs any introduction. I mean, I think a man who began his career in New Delhi, where he was born, did his radiology training there, and then moved to the southern part of the country in Kerala, and then made Kerala his home for a long time. Doing very pioneering work in radiology in Sri Chitra Institute of Medical Sciences, and his work is it's a pinnacle in defining vascular diseases. As we see, particularly in the subcontinent, particularly with aortic diseases, aortic arthritis, thromboangiitis, obliterans, etc. And I have seen several papers which were written by Dr. Ravi Mandalam in the same context. At the same time, he was developing a great deal of effort. He was putting in a lot of effort in developing the whole IR curriculum, along the lines that Kesavadas was describing. Now, who can we call a pioneer? A pioneer is actually someone who can develop a new method, or he applies that new method or knowledge, continuously. In medicine, this effort actually becomes all the more significant when that several patients can also benefit from what someone has developed or applied. And in that context, Dr. Ravi Mandalam can be considered as a true pioneer of vascular IR in India. At the time when, the remembrance from both Professor Rao and Kesavadas, when most of the radiology in India was still confined to dark rooms, and we were kind of groping with cumbersome machines, etc. And when most of the activity in radiology departments was confined to reporting of plain X-rays, people like Dr. Ravi Mandalam, along with, of course, Professor Rao at SET, began a journey which is pretty much along uncharted waters, and this was getting into angiography, vascular imaging, neuro and vascular intervention, etc. So wherever new technology was developing in the world, in other parts of the world, these thinkers were there to quickly evaluate these processes. They could embrace it, and because of their effort and persistence, you can understand how difficult it will be to get this sort of technology into India. It was very costly at the time, but I'm sure a lot of effort and pressurization from these people, persistence, has led Sri Chitra to acquire some of this technology, probably as a first in India at that time. Now, this was coupled with a truly innovative thing that, again, from the vision of Professor Pavithran, that they had to have a biotechnology wing in the same under the umbrella of SET in Trivandrum. And there was a constant interaction that Professor Ravi Mandalam and Dr. VRK Rao could establish with the technology department, and this led to the development of less costly materials which are suitable for our country. I mean, that was, even if they did not reach a marketing stage, we have to see how much of effort has gone into developing implants, materials which are of low cost, which can be given to our patients. And this resulted in prototypes of embolic materials like embospheres, glue, etc. And in addition to that, I think Professor Ravi Mandalam, along with his several colleagues who were, equally supportive, they established a continuous platform for exchange of ideas and knowledge in interventional radiology in India, taking examples from the best practices in the country. I remember visiting, big faculty from abroad and also exchange programs between faculties. And all this, it led to a lot of enthusiasm around the subject, a lot of youngsters getting attracted into the subject, and the formation of academic groups, associations, etc. IR in India is hugely indebted to Professor Ravi Mandalam and Dr. VRK Rao for their most significant contribution to radiology, and that is in developing the first ever postdoctoral fellowship in neuro and vascular radiology in India. I think it is probably one of the first in India. And after its establishment, you can see a large number of alumni has passed through this, and they have been properly drilled, they have been grilled, they have been well cooked, and they have in all parts of the world, taking this this message with them, practicing and training the next generation of radiologists. The efforts taken by Professor Ravi Mandalam and Professor Rao and are even more significant for us now in this specialty, where we are facing intrusions, a lot of intrusions from the untrained and the inadequately trained people. Let us take the example from them, and then we can go forwards with our specialty. He's Professor Ravi Mandalam is a widely respected teacher. I had the personal fortune of being his student. He's patient, he's a very patient man, and he has got a gentle air of authority about what he does. And he occasionally will make a sharp comment to, just make the trainee realize what his most important task is, and that is to apply himself and to learn properly. His attention and kindness, as Keshav was mentioning, it always drifted, and it is always open to any trainee who walked through the door, including those of us from medical college who frequented the department. He's an extremely well-read person outside of radiology, and he's a scholar who can often come in with a very apt quote from a famous writer or a classic. I was very, it was a moment of great happiness for me personally after several years of, him having left to Malaysia, where he works now in Sabah as a radiologist. After several years, I could meet him in one of the meetings in the same place in Kinabalu. I was very happy that he recognized me and remembered me. And we had a good time, a beautiful evening spent together. And we talked about old days and old friends. He also talked about his varied interests and hobbies, including photography and his mountain climbing, which he's absolutely passionate about. He astonished me, when he said that probably he climbed the 4,000 odd feet tall mountain, the Kota Kinabalu it's called. He probably climbed it nearly 50 times or something, he told, in the last 20 years. Now, I was sitting there and I was wishing in my mind that one day maybe I will also give that mountain a try. Somewhat similar to me wishing on my training days to do a procedure maybe as quickly or as neatly as Professor Ravi Mandalam would do. Thank you, sir, on behalf of IRIA for lighting the lamp of knowledge in interventional radiology in India, along with Professor VRK Rao. This is a lamp from which the light and spirit has traveled to several corners of India and the world. We are indebted to you both. Thank you so much.
Thank you, sir. Congratulations to Professor Dr. VRK Rao, sir, and Professor Dr. K. Ravi Mandalam, sir, for the award. Thank you, sir. Now to proceed to the introduction and honoring of the awardees for the ethical practice, I invite Dr. Govindan Nair, sir, Senior Radiologist, Thrissur, and may I request, sir, to introduce and honor Professor Dr. V. Pavithran, sir, and Dr. T.K. Chandran, sir.
Thank you. Good evening, respected dignitaries and my dear friends. Today is Ranjan Day, and I am very happy that 4 of our senior radiologists are being honored in this great online meeting. It is a great privilege for me to introduce to you all our 2 eminent senior radiologists whom we are going to honor now. They are Dr. VK Pavithran and Dr. TK Chandran. Incidentally, both of them are classmates for MBBS, and both wanted to become radiologists after MBBS. Due to time limit, I can only enumerate a few of their achievements, so kindly bear with me. First of all, I will introduce before you Professor Dr. Pavithran VK. He was born in North Kerala in Kannur district at Kuthuparamba. on 11th April 1948. He joined Calicut Medical College in the 10th batch in 1966. After house surgery, he worked as medical officer of Cooperative Hospital Tirunelli, Wayanad in 1977. He left the Cooperative Hospital and joined as tutor in radiology in Kottayam Medical College. After 3 years, he joined for PG studies in radiology. He took MD degree from the famous PGI Chandigarh. After PG, he worked as teacher in various medical colleges of Kerala, Kottayam, Kozhikode, Thiruvananthapuram, Alappuzha, and Thrissur medical colleges. In between, the central government posted him in Mali as superintendent of Indira Gandhi Hospital for 5 years. Throughout service, he maintained good relationship with the MBBS and PG students, colleagues, as well as with common people. He was also the superintendent of Thrissur Medical College for a few years, which proved his skills as an administrator. During his career in various medical colleges, he was active in medical associations like IMA, KGMCTA, and IRIA. He was the president of Trivandrum and Alappuzha unit of KGMCTA. He became the state president of KGMCTA in 1984. After a successful career as a medical college teacher, he retired from government service in the year 2003. After retirement from government service, he joined Jubilee Medical College as head of Department of Radio Diagnosis and worked there for 10 years. He was instrumental to start PG course in Jubilee Medical College. From 2013 to 2018, he worked as head of Department of Radio Diagnosis in KMCT Medical College, Calicut. Now he is continuing in KMCT Medical College as Emeritus Professor. Throughout his official career, he excelled as a doctor, as a teacher, and as an efficient administrator. He became a member of IRIA in 1977. From that day onwards, Pavithran sir was active in our association. As a member, he participated almost in all the association meetings. He received love, cooperation, and respect from all other members and colleagues, and he became State Secretary of IRIA in 1986 and 1987. In 1999, he became the State President of IRIA. His dedication to any work and ability to take and implement decisions on time have made him an unique personality. I am very proud to introduce such a leader to you. His better half is a housewife, and his 2 daughters are doctors, married to doctors, and well settled. I wish that may God the Almighty give him healthy, long life. Now I am going to introduce Dr. T.K. Chandran sir. He was born in the cultural capital of Kerala, Thrissur. He did his BSc Chemistry from the famous Thrissur St. Thomas College. Incidentally, I also did my BSc from St. Thomas College, Thrissur. He did MBBS from Calicut Medical College. As I said earlier, he was classmate of Dr. VK Pavithran. After MBBS, he went to Vellore Medical College and did senior house surgery for 1 year. Thereafter, he worked as a tutor in radiology in Vellore Medical College for 6 months. He attained his DMRD from prestigious National Institute JIPMER at Pondicherry in 1976-1977. After his PG in 1977, he joined as assistant surgeon in Kerala Health Services. His first posting was in Kollam ESI Hospital. After 2.5 years, he was transferred to Thrissur. In Thrissur, he worked in ESI Hospital Mulangunathukavu. District Hospital Thrissur and Thrissur Chest Hospital. While working in District Hospital and Chest Hospital, he had the golden apple opportunity to work in the radiology department of Thrissur Medical College. And he was a very good teacher, taking classes for MBBS students, especially in conventional radiology. He retired from government service in 2000 November. Since then, he is working as a radiologist in Polyclinic Thrissur. During these periods, he also actively worked in medical associations like IMA, KGMOA, PGSA, and IRIA. He was president and secretary of IMA Thrissur district and state president of Postgraduate Specialist Association. He became a member of IRIA in 1980. During that period, the association was led by Mr. Dr. Mahadevan, Dr. Chandrasekharan Nair, Dr. Eepan, Dr. Pavithran, Dr. Eknamari, Dr. Prasanna Kumar, and Dr. Sadi. He was loved and by everyone. He was loved by everyone for his simplicity and open nature. His knowledge, hard work, devotion to duty, and caring nature to all made him very popular among the radiologists and the medical fraternity. He earned respect through his lovable behavior. He became IRIA State Secretary in 1985. Professor Dr. Ratnakumari Madam was the then president. In 1986, he became IRIA State President. Dr. Shaji was his secretary. Being pious and simple, he has won all his endeavors. His wife is a teacher and he has two sons. Both are engineers with a master's degree, married and well settled. I wish him healthy, long life. Thank you all very much.
Congratulations to Professor Dr. V. Pavithran sir and Dr. T.K. Chandran sir. Thank you so much, sirs. Next, I invite Professor Dr. M. Venugopal sir, Head of Radiology at Regional Cancer Center, Thiruvananthapuram, to introduce and honor Professor Dr. Alex Ittiyavirah sir.
Thank you, Judy. Good evening to all. I feel actually very much privileged and honored to introduce Professor Alex Ittiyavirah. He is an emeritus professor in the department in the radio diagnosis, Tirunelveli, and he has got actually more than 40 years of radiology experience. And he is presently professor and head of the Department of Radio Diagnosis, Sri Uttaradan Tirunal Hospital, Academy of Medical Sciences, Trivandrum. Also, he is the director, Ittiyavirah Scan and Genetic Research Medical College, Trivandrum, and is the chairman, Jyotirgamaya Education Foundation. Alex sir, he completed his MBBS and MD radio diagnosis from Government Medical College, Trivandrum. And he has worked in various places, various government colleges in Kerala, Regional Cancer Center, Trivandrum, and also Amrita Institute of Medical Sciences, Kochi. And he attended numerous national and international conferences in radiology and ultrasound. And he presented several scientific papers and conducted many workshops in ultrasonography. And also, he is conducting annual conference in ultrasonography for the past 10 years. He has got 3 scientific papers published in international journals. And some books have been published by him. One is Jyotirgamaya Handbook on Fetal Sonography. Second is Glimpses in Imagology, Part 1, Part 2, and Part 3. And also one more handbook on musculoskeletal ultrasound. So he is the organizing secretary and actually is the founder of, and that club is actually a forum of diagnostic radiologists who used to meet and discuss various cases of academic interest. And actually, this was started way back in 1992, and it is still continuing. He is the organizing chairman, Jyotirgamaya Ultrasound Series, a national workshop on ultrasonography, and is conducted every year, and it is still continuing. And he is life member of IRIA, Indian Medical Association, Academy of Medical Specialists, Association of Radiation Protection, and Indian Federation of Ultrasound in Medicine and Biology. Alex sir, he is a fantastic teacher, and he is able to present difficult topics in a very simple way and also in an understandable way. And he is very empathetic, and he is always seen with a smiling face. And actually, it is a proud moment for the entire radiology fraternity of Kerala that Alex Ittiyavirah sir is receiving Ethics Award in the current year. And best wishes for Alex sir. And also, of course, the wishes also should go to, or should be submitted to, his better half, Lali Madam. All the best, sir, and Lali Madam. Thank you very much.
Congratulations to Professor Dr. Alex Ittiyavirah, sir. Thank you, sir. Further, I would like to invite Dr. Lali Alex Madam, Head of Department, Dr. Somervell Memorial CSI Medical College Hospital, Karakonam, to kindly introduce and honor Professor Dr. K. Ramachandran, sir. Over to you, ma'am.
Very warm greetings of Ranjan Day to one and all. With purity and holiness, I will pass my life and practice the art. He has never trespassed or violated the Hippocratic oath he uttered years back. No doubt, the most deserving radiologist to be honored for ethical practice on Ranjan Day 2021. Indeed, a very perfect selection of IRIA Kerala. It is none other than Dr. K. Ramachandran, former professor and head of the Department of Immunology, Regional Cancer Center. For me, it's a great honor and privilege to get an opportunity to unveil the ethical richness of this respectful awardee. Dr. K. Ramachandran served Regional Cancer Center for more than a quarter of a century, endowed with extraordinary professional accomplishments, yet with no pretense, simple, extremely honest, humble, down to the earth, yet successful, unconcerned of accolades, and free of fanfare. But many may love to follow his path of ethical practice. Even when he adorned the coveted chair of Professor and Head of Department of Immunology at Regional Cancer Center, he would happily share the departmental work of his colleagues, be it a faculty or a postgraduate student. Department of Immunology at RCC, as you all know, is a great place, giving wonderful service to a massive crowd. But Ramachandran sir never had an adrenaline rush. With a warm heart and a cheerful face, he would place a robin back to its nest again. As a guru for students, as a teacher for students, he was at his best. Well, I have not unveiled the voluminous academic accomplishments of Dr. K. Ramachandran. I could swear, without a pinch of salt or added color or flavor, I have tried to explore and expose before this august audience Dr. K. Ramachandran, the guardian and custodian of medical ethics. The only negative sounding thing I cannot resist exposing before this audience about Ramachandran sir is his reluctance to say no to anybody who approaches him. Last but not least, we would appreciate the successful women behind this successful man. Our great appreciation to Mrs. Leda Ramachandran, his best half. While my heart and hand reaches out to congratulate Ramachandran sir on receipt of this most treasured award of IRIA Kerala, we wish you, sir, many more appraisals and showers of blessings from God Almighty on your journey ahead. Let us pledge to emanate this great radiologist, Dr. K. Ramachandran, who is crowned by IRIA Kerala for his ethical practice. Thank you, and Jai IRIA.
Congratulations to Professor Dr. K. Ramachandran sir for the award. Thank you, sir, and thank you, ma'am. Now I request Dr. Rijo Mathew sir to announce the nominations for the Research and Innovation Awards.
Thank you, Avni. Before moving on to that, I think it's due from our side to invite the recipients of the awards to say a few words. May I now invite Dr. Ravi Mandalam sir to say a few words to this august gathering.
Thank you, Dr. Rijo. As you invite me to say a few words, my tongue becomes very tongue-tied. I'm overwhelmed by emotion and affection and the honor that you have bestowed on me on this very auspicious day, the International Day of Radiology. I thought Kerala radiologists would have forgotten me by now. It's 28 years since I left the shores of Kerala. It was a momentous time when I worked with Rao sir. I was but an assistant to him, so I don't know why I was selected today to be given an honor. So he was our hero. He was our, as I was telling Kesavadas, he was Sunil Gavaskar and Sachin Tendulkar rolled into one. And he was the opening batsman. He was the one who was facing all the fast bowlers, that's the challenges of neuroradiology. And we all played a supportive role, and he was our mentor. To be very honest, I did not even know how to do a femoral puncture and catheterization when I landed in Srikanth Institute. All this I learned from him. And of course, our guiding spirit was the great Professor M.S. Valiyathan sir, who was the director of Sri Chitrathanal Institute. Moving on, looking from the past towards the future, I am very heartened and very happy to see that interventional radiology is thriving. When I see the faces of so many young interventional radiologists here and young neuroradiologists here who are carrying forward the torch that Rao sir had lit and we all had supported at that time. I'm immensely grateful. And beyond interventional radiology and neuroradiology and all that, I am very grateful for this opportunity to meet up with all old friends like Professor Ittiyavirah and Professor K. Ramachandran, Lali Madam. These are all people whom we regularly interacted at that time during my years in Sri Chitrathanal Institute. So it is like a homecoming for me, and I am very grateful. And thank you all, and may God bless you. Thank you very much.
May I now invite T.K. Chandran sir to say a few words. Can you unmute, sir? Unmute. Oh, yeah.
Hello.
Yes, sir. Yes, sir. Please.
You can hear me. Thank you.
Yeah.
Thank you. Thank you for the association for honoring me for this ethical practice. I am actually a conventional radiologist, mainly interested in gastroenterology and urology. And still I do this work at Polyclinic, Rijo. Thank you. I also thank Dr. Govindan Nair for introducing me to this audience. Thank you all.
Thank you. Thank you, Chandran sir. May I now invite Dr. Ittiyavirah sir to say a few words to this august gathering.
Now, to begin with, I'm grateful to IRIA Kerala for considering me worthy of this honor. I feel truly honored and greatly appreciate this recognition. It is my great pleasure to dedicate this honor to my great teachers who are instrumental in molding me to this shape. The first row of which includes Dr. Ratnakumari, Dr. Nalini, Dr. K. Sudhir, and the late Dr. S.V.C. Panikkar, and the late Dr. Ramachandran of radiation physics. I also remember my great mentor, Dr. C.P. Mathew and Dr. Krishnan Nair of RCC, both were past Kerala IRIA presidents, who were called to eternity recently. In those days, radiology department was just a home away from home, with our teachers patting us and at the same time spared no efforts to scold us at our mistakes in their attempt to mold us. From those days, when we had exposure only to conventional radiology like barium studies and IVP, this specialty is witnessing marvelous strides of progress. While we celebrate interventional radiology focused Ranjan Day today, I cannot help remembering that in those days, way back in 1978, Ratnakumari Madam trained us to do blind aortogram and PTC. My pranam to my enthusiastic teacher. Now, my from 20-member IRIA Kerala at that time, with President and Secretary being elected by a simple hand raise, IRIA Kerala has now grown to a huge number membership now, with office team keeping IRIA active 24/7. The old homeliness of the radiology department, I feel, is gradually waxing and waning. And my plea to the budding radiologists is to build up this friendly fragrance and enjoy the learning of radiology. Equally more important than diagnosis is the ability to communicate with the patients and their relatives. The fine art has to be practiced throughout their career, and they have to try to improve upon it along with their diagnostic acumen. The Department of Radiology, unlike other medical and surgical departments, necessitates proficiency in administrative matters as well. Therefore, they should not shy away from administrative work during the career. I'm extremely thankful to IRIA Kerala, headed by President MCJ Prakash and Secretary Dr. Rijo Mathew, who considered to bestow this honor for ethical practice upon me. Thank you and thanks a lot.
Thank you, Ittiyavirah sir. May I now invite Professor Dr. K. Ramachandran sir to say a few words.
President IRIA Kerala, Dr. MCJ Prakash, Secretary Dr. Rijo Mathew, and the dynamic team of radiologists behind this program. I'm indeed delighted to receive this honor and be here among this galaxy of radiologists whom I respect. I have always been very happy to be with all these radiologists, and I fondly remember most of them and have been in contact with almost all of them except Dr. Ravi Mandalam, Dr. K. Chandran, and others. Otherwise, I know all of these radiologists, and I always remember the services they have rendered to the radiology department, and they have made radiology a big success through their hard work. And I was really impressed with the Professor Dr. Lali's introduction of my introduction, and I'm thankful. I thank Professor Dr. N. Nalini, who was my professor, who taught me radiology, and Dr. K. Sashidharan, who introduced me to oncoradiology. I fondly remember Professor Dr. Krishnan Nair, who has left us recently. I think when we joined two radiologists who could make an impact there, Professor Dr. Krishnan Nair and Professor Dr. VRK Rao, we followed their footsteps, and I'm happy we are now at this point of time where radiology is considered as a good subject with effective treatment offered to the masses. I am thankful to all of you for being with us. Okay, thank you.
Thank you, Dr. Professor Ramachandran, sir. Now I have the honor to announce the nominations for the IRIA Research and Innovation Awards. National IRIA has called for nominations for Research and Innovation Awards. For the last 40 years, as you all know, radiology has been the most sought after specialty amongst all medical specialties, and some of the brilliant brains have taken radiology. And what is the contribution of radiologists in research and innovation with respect to healthcare? So there are lots and lots of innovations and research happening from various parts of the country. So IRA decided to call for nominations from each state and to award them for the Research Innovation Awards. So I have two nominations here from state IRA Kerala. Can I have the next slide, please? One is on teleradiology. As you all know, teleradiology is now becoming a major route of which radiologists work. At the same time, there has been lots and lots of issues related to that. So two young radiologists have come out with a software that, with a technology that helps radiologists to get a better footing in teleradiology practice. They started a company called Aramis, a startup which is recognized by the Startup India and Kerala Startup Mission, and has commenced operations in Technopark, Trivandrum. The next slide, please. So the product, Ocular, is a unique, first of its kind DICOM viewer that has been completely developed at Aramis using JavaScript for a rich and fast client-side experience. The viewer runs completely on the browser and is optimized for Google Chrome, which makes it accessible on any device with an internet connection anywhere in the world. Built and designed by radiologists for radiologists, the viewer addresses several wishlist features that have been garnered from real-world reporting experience. These include ready reference tools, RATS calculators, in-window anatomy reference images, and even synthetic MRI. Next slide, please. So their next innovation was a Radium. It's an in-house zero footprint capable open teleradiology platform coupled with a variable footprint HTML5 RIS solution and fully integrated with Ocular, the DICOM viewer. Next slide, please. So the two young radiologists, mind behind this, I'm happy to announce and proud to name them. Next slide. Dr. Anil Prahladan and Dr. Ganesh Sukumaran from Trivandrum. They are the nominations, the first nomination for the Research Innovation Award from State of Kerala, IRIA, is the Aramis, the Ocular software by Dr. Anil Prahladan and Ganesh Sukumaran. Dr. Anil Prahladan is here with us, and I would like to have a few words from Anil Prahladan on what his innovation, and he can explain to us. Dr. Anil, please.
Good evening, everyone, respected teachers and my dear friends. It is indeed an honor to be nominated for this award. At the outset, I would like to quote Sir Isaac Newton, who has famously said that if we have seen farther, it is because we have stood on the shoulders of giants. And it's really a pleasure that my teachers who have taught me during my undergraduate and during my PG days, Dr. K. Ramachandran, Dr. Venugopal, Dr. Kesavadas sir, Ittiyavirah sir, and Lali madam. These are all people who have taught me during my UG and during my PG years. So, and I would like to apologize on behalf of Ganesh. Unfortunately, he is affected by COVID and he's at home recuperating with his entire family. So he couldn't attend this meeting today. About the product or the software, what I would like to say is that this is a completely new radiology companion viewer that we have developed, which has been designed so that you do not have to move away from the comfort of your computer screen in order to refer anything or to a report or to even calculate scores or any other criteria that you require in radiology. We have built in intelligent features that include automated measurements and also in-window reference for your anatomy atlas. And the entire thing has been deployed on a very lightweight teleradiology platform, which we are actually planning to call as the first open teleradiology platform in India. You do not have to depend on any third-party IT service provider in order to do teleradiology. You can sign up for this by just visiting our website and actually start your own teleradiology practice without having to be worried about somebody else taking you for a ride for teleradiology. This is the intent with which we have created this software, and we believe that it will really enhance your work environment as such. Further technical details probably this is not the right platform for me to actually say, but I would like to once again thank everyone for the nomination and for IRA for actually bringing out such endeavor, because it's really inspiring to youngsters like us, although I don't qualify as a young person anymore probably, but at least for us, it's an inspiration to do something innovative. Thank you very much.
Thank you, Dr. Anil Prahladan, and we wish you all the best for your venture. And I am sure this innovation will encourage more young radiopreneurs to come out with better solutions and better solutions in the radiology and healthcare practices. Thank you, Dr. Anil. Let me introduce the next nomination for the next slide, please. Nomination for the Research Innovation Award that we have nominated from IRIA Kerala is this innovation is a peanut safe syringe, an innovative invention that was designed by a radiologist from Calicut, Dr. Baby Manoj. One of the many challenges faced by the healthcare industry today is the reuse and improper sterilization of syringes and the significant risks in the transmission of bloodborne pathogens. Immunization campaigns present their own risks of unsafe injection practices. Next slide, please. So young Indian, Dr. Baby Manoj, who is a radiologist by profession, has come up with an innovative invention, a peanut safe syringe, which is first of its kind and the most cost-effective of all safety syringes available in the market. On considering the hidden cost of biomedical waste disposal, it is even cheaper than the existing disposable syringes. For his invention, the young doctor got the Best Invention Award of the year 2011 from the World Intellectual Property Organization and the Innovation Award for the year 2011 from National Research Development Corporation. Next slide, please. So he has already come on the covers of many of the magazines. Next slide. Already awarded the Outstanding Young Person Award by the JCI, and the next slide. By the National Research Development Corporation. So this is commercially now available, and I also congratulate Dr. Baby Manoj for his research and innovation and his entrepreneurship and for his venture. So these are the two nominees from IRIA Kerala for the National IRA's Research and Innovation Awards. Thank you.
Thank you, sir. And congratulations to Dr. Anil Prahladan, Dr. Ganesh Sukumaran, and Dr. Manoj sir. May I welcome Professor Dr. Srikanth Moorthy sir, Head of Department Radiology at Amrita Institute of Medical Sciences, Kochi, for the keynote address. Over to you, sir.
Thank you, IRIA Kerala, for giving me this opportunity. Actually, I tried to wiggle out. I must thank you now for your persistence. I also must thank the IRA for putting me in front of Rao sir and Ravi sir. I know them very well, so if I were to say that you are my inspiration, they think I'm a fraud. So I will modify that statement a little bit by saying that the atmosphere that was created by you people in the department was the inspiration, and I have managed to actually transplant that atmosphere to my department, and that is one of my greatest successes. And I'm proud to say, somebody asked me, what is that I've done great in Amrita? It's just that no one has left. None of my colleagues have left ever since they joined. And I think the primary role of the head of the department is not to destroy the department. And with those words, I would like to quickly get on to my keynote address. I was actually wondering, what is that I should talk about? So I was reminded of this book which I have read. It's the famous story by Ernest Hemingway, The Old Man and the Sea. Many of you might have read it, but just to make it short, there is this very old fisherman who is on his last legs, and he is forced to go out fishing one day, and he makes a catch of his lifetime. A big fish latches onto his tackle and draws his boat out into the deep sea, and he fights with it for day and night, using all his experience and ability and the effort and everything. He has to use every trick he has learned in his life to fight the fish. Finally, he wins, and then he slowly sails back, tired and exhausted, back to his village. Somehow managed to dock his boat, crawl and go out and go to sleep. That's it. But what has happened is, while he was dragging the fish over the ocean, it's getting eaten by the other fish. The next day morning, when people come and see the fish, they just see a boat that is tied to a big skeleton. So the whole point of the story is that some of your greatest struggles, some of your greatest challenges, you are the only witness. No one can be a partner in your life's experience. Your struggle is your own struggle. So I thought that if I were to show you some fantastic slides of great cases I've done and all that, it may be like showing you the skeleton. I thought it's better that I talk to you face to face, heart to heart, about the struggles that I've been through in the last so many years, trying to establish and maintain this practice. So in the beginning, back in 1993, when I did my PDCC in Srikanth, really there was zero awareness of interventional radiology outside. I mean, I know I have been to several hospitals, asked them about whether they have a role for an IR, and nobody had even heard of the term interventional radiology, and there were no openings. So what did I do? I prostrated myself at the feet of the MRI god, and for a few years I was practicing MR. It was only in 1998 that by sheer accident, an accident that was partly created by Dr. Ravi Mandalam here, that I joined Amrita, in the sense that he was the person who sort of tipped them off and saying that this guy somewhere hired him. So that's how I landed up in Amrita Institute of Medical Sciences. And I couldn't believe it. I was walking to the department and they showed me a DSS system and they said, it's for you to do whatever you want. So that was completely way ahead of its time to give an interventional radiology a machine of its own. And it was that way great. But the problem is, when we went there, we were trained in vascular intervention in Srikanth, and we had to start hepatobiliary work. We didn't know a thing about hepatobiliary work. Now, remember, in 1998, we had no mobile phones. There was a very weak early dial-up internet. There is no Zoom, no YouTube, no nothing. So how do you even learn a procedure? It is something that is very difficult to imagine for many of today's people. You have to open a book, see some static pictures, imagine what they would have done, and then try it out with whatever you have. And then, see what happens, and then go back and try again. So it was very difficult, but it was very challenging and very, very, it was the kind of teamwork. See, it led to a very close collaboration with the surgical team that became very essential, and that's what we did. Now, the point I want to make here is sometimes people would advise you that in interventional radiology should be very assertive, we should be independent, and we should be very competitive. But let me be very honest, we have gained a lot in America by keeping a relatively low profile. So what happens is, for example, if you take the vascular intervention that we did, we did a lot of great below-knee angioplasties and all that coming from the diabetic and endocrinology departments. Now, the last thing they wanted was give it to the cardiologist. You were desperate to get it. If you give a case to the cardiologist, you put a stent in the heart, and then you will also tell the patient how to treat the diabetes. If the endocrinologist did not want to. So all the cases used to come to us. So, what is the strategy that an interventional radiologist should have? Is something that, there is no single strategy. I think it is best to, sometimes you need to be assertive, sometimes you need to play a passive person. Because one thing I feel is it is important for us, even within the hospital, to have a wider referral base so their practice is protected. Now, coming to some observations about, a newly appointed interventional radiologist. I think this is something that continues to be a problem in many parts of the country now. Definitely, the attitude outside has changed from what is interventional radiology to where is the interventional radiologist. That has a difference that has happened over the last 15 years. Especially in Kerala, this is to a large extent, we have to say thanks to the liver transplant program that has created awareness that you need a general intervention person to handle a lot of things happening in a liver transplant scenario. Now, if you take the ISVIR, our national body, I think Ravi sir and Rao sir will agree with me that the first few years of ISVIR, things actually got very boring because we went to the meeting, we had the same guys talking the same topic with the same audience. And it was really didn't look like we were going anywhere. Honestly, towards the year 2009, 10 and all that, I decided, okay, I'm not going there. I'd rather stay at home. I don't want to see the same topic. I don't want to speak the same topic again. That kind of thing, Then, about 2014, I realized that suddenly it happened in a meeting in Goa. I landed up, I had missed about 1 or 2 ISVRs. And then suddenly I found myself in the middle of a crowd of people and I was a complete stranger. I didn't know anybody, they didn't know me. There was suddenly a whole lot of new people there and a new generation. They all appear more focused because we had to do everything. We had to do vascular, we had to do biliary, we had to do this, whatever comes our way. So the new generation is out there. And it is only in the last 6 or 7 years, I would say, that things are really looking up. Now, the problem with interventional radiologist starting out in his career, joining a hospital, the one question that the management tends to ask is there work for a full-time IR guy? And the interventional radiologist fellow, on the other hand, is thinking, will there be enough cases for me to have a decent salary? Because I think one thing is certain, you can't be paying a diagnostic guy, let's say 2 lakhs a month. And the interventional radiologist gets, something out of 2-3 cases he does in a week and goes off. There's no way you can do that. It just won't work. So it becomes like a chicken and egg situation, The work is not sufficient now, but unless you have an interventional radiologist, the work won't increase also. So which one do you do first? The answer to this problem is, I think, managements must have a clear vision. Because now, dedicated IR is an essential thing. A modern hospital, there's no doubt about it. And that way, I would say, Amartya is a good example. In 1998, they thought way ahead. But this is important. So how did Amrita manage to fund this IR work that we were doing? We were doing in the beginning what? Maybe about 2-3 cases in a whole week. IR was part of radiology. the revenue share. So there is security everywhere. We are able to work, we are able to decide what cases we want to do. There's no pressure on us to do unnecessary things. So this is, I think, at least to begin with, till IR becomes independent economically, that IR should be part of the radiology department in a sense. And I also feel that we IR people in America, we contribute a lot to the imaging also, because I feel the way we can interpret an MRCP or a peripheral vascular CT or MR or Doppler, this actually adds value to the imaging side of the whole thing. So we don't, in our department at least, draw a clear line, and I think it's a good thing. May not always be possible, but that's how it has worked for us. Now, in any case, I think IR must have a good symbiotic give and take relationship with the general radiology department. That is very, very important. Quickly going on to some lessons that I have learned in practice, some memories that have stuck with me. The first case I picked up because I actually, this is something that I never forgot. But I'm actually, it's coincidence that Dr. Ravi Mandalam is sitting right across from me here. It was one of the very first peripheral vascular cases that we did in America. Myself and Nirmal Prabhu were the people who did the case. A 69-year-old guy, no other problem, just a left calf claudication. He had a left SFA occlusion. All we had to do was puncture the right SFA, cross, and do the procedure. Everything went like clockwork. We opened the artery, everything was fine. We came out, took him to the ward. By night, he was screaming in pain because in pain on the right foot, which is not the place we angioplasty. We had angioplasty with the left SFA to a right femoral approach. We had no idea what was going on. This is one of the first cases we did. Within two days, the toes of that right foot were blue in color. There was discoloration of the calf. Things were looking horrible. Suddenly, we realized that this is something called cholesterol embolism. This is something that has been taught to us in Chitra. I had never seen a case, and I have never seen a case after that. I have drilled myself through kilometers of femoral arteries and common leg artery. I have never seen it. But this was one of the first cases, and we had a catastrophic thing. We tried everything. We tried all the regular, vasodilators, prostaglandins, everything. Nothing worked. He lost his foot and all the toe of the normal side. So, point is, you realize suddenly that your bad case need not be your case which comes when you're really experienced and all that. It just happened as one of our first cases. He never went to court. He never created trouble. I mean, we were just very, very lucky. But I can never forget this. I can also never forget a 15-year-old girl who had butt shearism. And we have this tendency not to do tips in every case. If you find a femoral vein that is, we can open up, we tend to open up. They do very well. So this child had a middle hepatic vein that was, openable. Okay. So we went percutaneously, got into the hepatic vein. We were crossing, just a centimeter from the centimeter occlusion. That's it. You just have 1 centimeter between the IVC and through. So I remember I had a little difficulty in passing the wire. So I reversed the thermo wire, took the stiff end, just poked once. I was through into the right atrium. I checked with the catheter across. I was in the right atrium, no problem. And I just dilated it by about 4 mm balloon. So the next step is I just put the stent, balloon expanded stent, and I opened the hepatic vein, job done. Beautiful. Suddenly this baby, this child, 15-year-old child, she drops her BP and not revivable. They did everything possible. Suddenly the anesthetist realizes he can't hear the heart. Then bring in the echo, you put the ultrasound and see the whole pericardium is full of blood. We rush the patient to the theater and find a big hole in the right atrium. And whatever they could do, they opened the chest, they opened the abdomen. They could not help the child. What had happened is the wire had slipped out of the hepatic vein and directly punctured the right atrium. It was just, these are all just about 1.5 centimeters in distance. And on frontal fluoroscopy, I could not see this happen. Of course, after that, I always use lateral fluoroscopy or oblique fluoroscopy to ensure that the wire goes in the right direction. But I remember now, nothing about the procedure, but I remember sitting with the father and trying to explain to him what happened. I really don't know whether I was defending myself or I was consoling him, but something burned into my soul, that particular moment. And I think the point I wanted to make here is, what I strongly feel is, apart from knowledge, skill, and ethical approach, one very important virtue that we must have is fear. And a fearless doctor, I feel, is a dangerous doctor. And because I honestly say, fear is what makes me plan a procedure meticulously. It makes me run the procedure step by step through my head the previous day. It is the fear that makes me discuss with my colleagues every single step. Fear that makes me think, okay, I must have a plan B. And it's also a very important thing that before you do a procedure, that you must know when to give up. It is important to set limits to how long you will try, what all you will try. This is very important because one very common thinking process, especially among surgeons, and I think it sort of gets to the interventional radiologist also, is that there's no hope for the patient if I don't do something. This is exactly when you start playing God. And I think this is something that you should know. If you must know your limitations, it requires humility, and it will be good for the patient. The other thing is, this is not a cliche, but I think it's very important to talk to the patient. It is surprising how little surgeons tell the patient, even when they do big surgeries. When you speak to a patient, let's say about liver cancer, you talk to them about the cirrhosis, the role the tumor plays in the overall process. Patients sometimes just get up. I've seen patients who I've told all these issues and told them, I think best that we don't do anything. And I have seen patients with tears in the eyes getting up, shaking my hands and saying, sir, thanks for telling me this. The point is, I'm reminded of the motto of my medical college. We used to make fun of it when we were, MBBS students. It's called Veritas Cure. Truth cures. We used to think, what is the big deal, man? Truth cures. The point is, patients actually come looking for truth, for answers. And the cure you can offer is only one of those answers. This is one thing we must remember. So, moving quickly, jumping on to another issue, which I think the IRIA is so much bothered about nowadays, is turf. So, whenever I talk, there is so much discussion of turf issues, I think we have been so battle scarred by turf. So we have seen so much of it that I feel that this discussion is too pointless, and I don't really take part. So, but at least in this forum, I think I will tell you what happened actually. See, the two areas in which we were really good, out of the world, I would say, we were very good at hepatitis very well. We were very good at peripheral vascular, very good. And in these things, we were as good as anybody in the country. Till a few years back, what happened is one very fresh, young vascular surgeon joined with not much experience. Immediately, cases were being referred to him. He was obviously having trouble with especially the small vessel disease and all that. No problem. He was doing cases. Then what happened is within the last 2-3 years, the entire diabetic foot program, for which Amrita have become very famous, for some reason, for competition, resignations and all that, the whole program is wound up. Now he's also got no cases. The point is, this is one risk for IR. That is, as I mentioned a little earlier, if your referral base is just one department, which is doing a lot of volumes, if something happens there which is beyond your control, then you may be left with no cases. So this is something that we went through. Now, an even more crazy story I want to tell is about neurointervention. See, we were all basically trained in neurointervention long back. That's very long back. The material was different, everything was different. That was like medieval period compared to the current state. But still, because of my connection with Dr. Santosh, Joseph, and all that, I actually went to Ramachandran, literally retrained myself and got to know everything. And I started around 2010, myself and Dr. Srikanth, two of us, we started neurointervention in very close collaboration with our neurosurgeon. Okay, so we started doing aneurysm trial. We even did a very good basilar artery series of cases. Luckily, very good case selection, not many problems. We were anyway doing AV fistula management even before that because we were pretty good at angiography. So use of glue and all that which we learned from Chitra. So all that was happening. Now, suddenly, this neurosurgeon, due to some political issue with the hospital, he resigns. The political atmosphere becomes so toxic for us that we thought no point to getting it. We got out of the cold scene. Okay. Now, if that is not the whole part of the tragedy, what happened is you had suddenly a neurosurgeon who had not even done angiography started doing this. So you mean to say he has no idea, about dissection or compression at the puncture side, no basic technique, nothing. I have even seen coiling of the aneurysm happening into the subarachnoid space, crossing the aneurysm into subarachnoid space. No problem. Nobody's got any complaints. And slowly over a period of last 3-4 years, because he's a neurosurgeon and he knows the anatomy, he has improved. Now, in the same period, myself and Sukumaran, we were doing carotid stents. We were pretty good at it. I'm not trying to blow my trumpet. We used to do the occlusion technique. So you do the double balloon occlusion technique. So you completely stop the carotid flow. We thought it made more sense than the filter wire and all that. And 10 minutes of occlusion, you finish the job completely. And the patient in and out, half an hour. That's it. Today, neurologist is also there. Again, that guy neurologist also went, another neurologist came. It takes 2 hours to puncture the artery, if you're lucky. 4 hours for him to give up. Okay. The latest stent actually was put in the carotid artery beyond the stenosis. Many times the carotid gets occluded and, or he never even reaches there. Technically, completely crazy. Yeah? And clinical results are also amazing. So, but the point is, it is continuing. So, what does this teach us? I think there is a very bitter lesson here, is that quality of your work does not appear to be a safeguard for maintaining your practice. This is a very important point, actually. And patients and even some managements, honestly, have no idea what is the standard of care in these procedures. The complexity of the whole thing is beyond their comprehension. And what I found really surprising, which we felt almost broke our heart, so to speak, was that how can a good program where no complications, people are so efficiently doing it, completely deteriorate to this level, and still nobody has got a problem. So one thing that a very moot point, I would like to raise before I quit this topic is that I'm not talking as an interventional radiologist here. I'm talking as a citizen, a person who is also a consumer of healthcare. Is that should actually we be doing procedures like this in a society where the society itself has no idea what is happening or how to regulate it or what is the standard of care? I think things much simpler than this are banned by the government, by the way. But this seems to be happening, and this is crazy. And this goes beyond a simple turf issue. Now, it looks very funny that I stop this and go to my last part of my presentation, that is the future of IR in India. So I'm not being cynical about this. But the truth is, like I told earlier, there is a huge number of people and opportunities also. That's also a fact. But to be very academic about it, I think there are two ways you can look at it. One is the very good future qualitatively. In other words, you have new techniques by which intervention can be done. Like I think robotics is going to make an even bigger difference in terms of accuracy of needle placement, and robotics may also come in actually catheter super selective placement and all that. So areas which are very difficult to reach, now we will be able to reach. You may get better visualization. Imagine if you get a microelectronics, you have the guide wires can also see in terms of ultrasound or optics. I mean, you will be able to, for example, something like trying to cross a post-transplant biliary structure is horrendously difficult sometimes. So you have a vision inside, you make a difference. So these are things, things which are even beyond what we imagine today may be possible. I think they have come all of a sudden very quickly. And areas like prostate embolization, joint pain embolization, thyroid nodules, all sorts of new areas. I'm not sure now whether they are approved or ethical, some of them, but there are no new areas in development. And the whole treatment of cancer is turning to biologicals. It's just not simply cytotoxic drugs. So that is a whole area where super selective delivery of the drugs will be necessary in various organs. So I think there is a tremendous scope out there qualitatively in terms of how it will change and our role. But I honestly believe that if you want to talk about the future of IR in India, it has to be in numbers, very simple. More number of people, more number of procedures, more number of places also. This is also very important. For example, there's a desperate need now, I feel, in smaller hospitals and smaller towns for actually doing small procedures. This is something we have to recognize. So, for example, simple procedures like drainages, vascular access, biopsies, these have to be done. And it's also important that fellowship programs are coming all over India, which is a very good thing. I mean, this is a way to go. This is where we get recognition, we get accreditation, everything. But we cannot wait for fellowships people to spread all over the country to do all these things. So the future of IR is also in the hands of the regular young radiologists who are spreading out into smaller areas of the country. I can tell you now, Dunbar, if you ask me what is Dunbar, I can think about coal and mafia, that's it. But today, in Telegram app, I'm seeing 3 lakhs, 4 lakhs for a radiologist in Dunbar. That means there are people there who can pay for imaging. Things are developing in this country in a remarkable way. There are big centers coming in areas which I have to Google to find out where they are. So, but those radiologists who are going there have the responsibility of actually offering these services at least part-time. This is very important. I know of my students, for example, in Kolhapur, for example. I was there a few weeks back, and this guy he's having a chain of MR centers in Kolhapur, doing very well. But that day evening, he was late to meet me in the hotel. He came with an image. He had walked into a cardiology lab in a patient who they had inadvertently created a large pericardial hematoma. And he had helped them put a catheter into the pericardium, percutaneously using their echo probe. He showed me the pictures. He does MR and CT most of the time, but this guy is offering that service. And because of that, he's got a name, he's got a reputation, people trust him. So this also puts a responsibility on the PG training institutions to equip our students with basic skills. Then only they can go out and do these things. And it is my advice to young radiologists out there not to shy away. You get a chance to puncture or something, you must do it if you have got the basic idea. Okay. And I think the younger radiologists are very bright. I know my postgraduates, they're all very bright, street smart, and they are very focused and very practical, not like us. And they also have a roadmap for IR. They know where it is going, what are the areas, which we had no idea at that time. So on the other side is the recognition that IR is an essential service. So these two forces will invariably come together, and I think they have a very good future. But for my part, I am just simply grateful to God that I was, guided in the right direction by, my teachers. I remember Dr. Nalini, Dr. Ramachandran there, and I remember VRK Rao and Ravi. I think they, again, I will not use the word inspiration, but they were a great source of, great sort of support and, this kind of direction. They gave me the direction. They told me they gave me what I should be doing. And I was lucky to actually see the sunrise of specialty here in India. That is something that I am very happy about. We were able to train a lot of people and also guide a lot of young radiologists who are now practicing IR all over the country. It's a matter of great pride for me and my colleagues that we have achieved that. Thank you very much for this opportunity. Thank you.
Thank you so much, sir. Now for the final program of the function, I invite Dr. Jassim Koya, consultant at Maulana Hospital, Perindalmanna, to conduct an interview with the 2 women interventional radiologists in Kerala. Over to you, Dr. Jassim.
Welcome, ladies and gentlemen. Thanks for joining me. We have today with us 2 wonderful, talented, exceptionally skilled interventional radiologists, Dr. Shakti Parvati, who is working in Medical Trust Hospital in Ernakulam, and Dr. Manisha, who is working in Rajagiri Hospital in Alua. I am Dr. Jassim Koya, so grab a cup of coffee or tea if that's your vibe, and let's have a quick chat with these two wonderful, beautiful radiologists. Welcome, Dr. Shakti and Dr. Manisha.
Thank you for the warm welcome.
Nice to see you here on this platform. nice to have you both.
Called the praise.
Oh, okay.
That was nice to hear.
It's actually, you are actually a rare breed. You have to know that, no? I mean, the sense there are very few lady interventional radiologists, as far as I know. So I'd like to know, firstly, either one of you can take this question. What drove you to take interventional radiology as opposed to, say, diagnostic radiology? What was the driving force behind you?
Not as opposed to, I would say that not, we can't say as opposed to. We have come through diagnostic radiology and we are still a part of diagnostic radiology. But yes, one thing that what drove us to the interventional radiology for me particularly, what was that when I was doing my first degree in the radiology, that was my DMRD in Kolkata in IBJMR hospital. We didn't have much of interventional radiology setup, and we had, on the name of interventional radiology, only thing we had was few FNACs, biopsies, and drainages. But our teachers there, they were excellent, and they knew that what is interventional radiology, and they literally drove us to it. And the fire which they started that time, that went on, and for my second degree in the radiology, that was a DNB in the St. Stephen's Hospital. When my counseling was going on, particularly I was looking for a place where I can get an interventional radiology setup. I had all India on my map and I didn't have any place bar, but I was just looking for a place where I can get a hospital to work, where I can get some introduction to interventional radiology along with my DNB. And that was started from the spark during my DMRD, and that went on progressively.
Excellent. That is what drove you here, no? So, I mean, in the sense, you still do consider that diagnostic radiology is still well and truly part of radiology. It's not just interventional radiology alone. As far as the treatment aspect is concerned, like diagnostic also has a great part to play.
Definitely.
Yeah.
It is a backbone of interventional radiology. Because first you have a diagnosis, only then you can treat. And if you don't know your radiology well, then you can't be a good interventionist. That is what I feel.
Okay. And how about you, Dr. Shakti? What took you here to the IR?
Actually, my choice of IR was not as exciting as Manisha's. Our hospital, actually, our ND, Anthony sir, wanted somebody to do intervention. So when he asked if I was interested, I just agreed. I just wandered into it without actually, considering anything. But once I got into it, then it is very exciting.
Then you got the spark as well. Huh? Then you got the spark as well. Once you enter,
exactly. Once you entered, then you cannot escape it. No? Yeah.
They say fortune favors the brave, no? So you have to be very brave to take up IR also. Because it's not, you have a lot more responsibility.
Yeah. In my case, it was more like ignorance is bliss. I just jumped in and then I had to swim and get out, So
that's just you. That's you being modest.
No, I would like to break that sentence. You have to be brave to come to IR. No, you don't have to be brave to come IR. Once you come to IR, IR will pull you if you are meant for it and if you like it. But there are a lot of other subspecialties in the radiology, or a lot of other diagnostic part in the radiology, which is excellent, and I think that is much more difficult than IR.
That is also true.
Okay. Now, what are the challenges that you have faced when coming into IR? Like, as in from your routine work of diagnostic, when you come into IR, what are the? Have you faced any difficulties along the way? And if so, yes, what were they? Either one of you can take this. I just want to have your perspective in as an IR.
The main difficulty that I feel is that when we are radiologists, we have a slight clinical disconnect. We just we report. Of course, we look at the symptoms and everything, but we lose touch with the patient. So shifting focus from radiology diagnosis to completely going into a clinical field was little difficult for me. And also I had been a diagnostic radiologist for a long while before I got into IR. So getting accustomed and finding my bearings and shifting focus was very tough. Once you start, and I was very slow, I had to take things really slow, but my colleagues were very, very supportive. So then I slowly kind of got my bearings and found my way. But I think for Manisha, it was different because she always wanted to do it. And she went in fast, isn't it, Manisha? Directly from radiology, you went quickly to intervention. I practiced for a while and then I went in. So that was my main challenge, actually.
That's a time
I have to
difference.
agree. Actually, some of the key things which were highlighted is that we should stop being just radiologists who look only at images, but rather we should be clinical radiologists. Those are the radiologists who look at the patient holistically as a whole and not just a set of images. So only then, like, obviously that improves your diagnostic accuracy. And as far as IR is concerned, obviously it has much more meaning and relevance when you look at the patient as a whole. Yeah, that is true.
Actually, radiology needs a lot of big transformation. Actually, there's a demand of time. Unless we transform, we won't survive. So that needs actually, and that's another long discussion. Won't be fitting into our time today.
Okay. And like, what do you think the future holds in IR? What is it that interests you about things to come in IR?
Things to come in the IR, if we count the processes, I think we have a lot of processes which are underutilized at present, and we would definitely like to overutilize it, and we would like to at least get into more and more new fields. Like even in the at present times, we have a very few people who are in IR, and most of the hospitals, they don't have IR. First of the things which I would like to focus on the IR is to increase the number of IRs and increase the hospitals which has the access to IR. And we have plenty of process already, and there are many other processes coming up. We are now starting the middle meningeal artery embolization for the treatment of subdural hematoma, and we have seen it vanishing away like anything, which nobody could ever imagine. Even the middle meningeal artery embolization has been used nowadays for the headache treatment, and even for migraine, it's found to be effective. So potential is huge, but we need people to take it up, and we need to fight a big tough war to keep it to the radiology and to keep the radiology inside the interventional radiology.
Yeah.
So that is the main future challenge which we have.
Yes.
That's true. That's true. These things are actually very interesting, no? Embolization of middle meningeal artery, geniculate artery for osteoarthritis and inflammatory arthritis, and all these things, and treatment of, say, benign intracranial hypertension. So many things coming up in IR. And yes, like Dr. Manisha said, it's all very underutilized. There's still a lot of potential. Yeah, a lot more cath labs and a lot more IRs are actually needed to treat so many of these things. Yeah, that's true. So I'd like to know one more thing. Like, if you look at any medical college, or generally there are many radiology PGs who are ladies, who are female radiologists, basically. And but when that comes into IR, there are very few of you who are interventional radiologists. What is the reason for this disparity? Is there any particular reason for fewer lady radiologists taking up IR? Do you have anything to single out on that? Yeah.
I think one of the main things is, I think, fear of radiation. There is this big scare about the radiation that you will be exposed to. And another thing is concerns whether you can juggle your family life with something which is more demanding compared to diagnostic radiology. I think people who choose diagnostic radiology do it because they have fixed hours, they can devote time to their family. So I think that is a mindset that has to change. I think it is just a question of changing your mindset, and you can easily juggle your career, and your interventional radiology is very satisfying. So you can easily, because there are gynecologists who have grueling schedules and who manage their work and their family, and they're very successful. So compared to that, IR is not so busy, and I think women can easily do it. It's just a mental block, I feel. And I think more awareness, more exposure will really help more women to take it up. That is what I feel. But I don't know what Manisha's contribution.
Right, I fully agree. That is, those are the main two important reasons. And if you see even the cardiology, intervention cardiology is a main part of cardiology right now. But you see very few females in the intervention cardiology. So that there's a same fear over there. A lot of females come into medicine, but very few of them comes into the cardiology afterwards. They go into other departments, they go into other areas. So it is a social mental block, not only a mental block of particular field, it's a social one. And we are at fault. We should be breaking it, and hope we can break it over time.
I know. So I think this is a very good initiative, and I really have to thank Dr. Rijo for this idea, because this is one of the steps that we can take to make more people aware that it is a very good profession even for women. And the more women come, they can easily balance life and career. Radiation is not at all an issue. It's not at all an issue if you're careful. That is another thing that I feel we should say.
Excellent.
All occupations has their own method. We don't need to know how to manage them.
We'll just add on to that. Are there any closing remarks or anything you would like to say for budding radiologists who want to take up IR?
Yeah, like Manisha said before, please do consider IR. Like she said, it has to be kept within radiology, because I think at the end of the day, we are the people who are best equipped to do intervention because of our background in radiology. So I think more and more people should take up IR. Every hospital should have a cath lab. And more, every hospital should have a cath lab, and IR should become a mainstream system of treatment. Even doctors are not aware of so many procedures that we do. So I feel it should be accepted. Doctors should send people more, say that this is an option that you should consider. Should become that mainstream is what I feel. So I think everybody please do consider a career in IR. That's my message.
Dr. Manisha, any closing remarks?
Yes, so as Madam said, we would definitely invite everybody to come to IR, whoever is interested. Means it's not that it is IR is the only field. We have a lot of subspecialty in the radiology. So any of them can be taken up, but now it's the time of subspecialty and super specialization. And radiology is fighting a big battle, big tough war, whether it is a diagnostic or interventional. So we need to be more and more active. We need to be improving ourselves in a lot of areas. And I would say that the IR should be the part of the basic radiology training. That's the time when the person knows to radiology, and that's the time they can find out that whether they like IR or not and how it is their inclination toward IR. And that should be the part of examination as well. So future is bright if we are active, but we need a lot of work to be done.
True. Thank you. Thank you all for joining. Thank you, Dr. Shakti. Thank you, Dr. Manisha. And I'd like to take this opportunity to thank IRIA Kerala for organizing this program in celebration of the International Day of Radiology, which incidentally also happens to focus on interventional radiology, active care for the patient. Thank you all for joining today. Thank you very much. Have a good night. Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Thank you, Dr. Jassim, Dr. Shakti ma'am, and Dr. Manisha ma'am. Before we conclude, I invite Dr. Shakti Parvati madam for the vote of thanks.
Hi, am I audible?
Yes, ma'am.
So we've had a wonderful session today. I was very pleased to be a part of it. And today was a day Ranjan discovered X-rays. So beginning with the discovery of X-rays and going on to multi-slice CT, MRI, interventional radiology, artificial intelligence and robotics, radiology has made a trailblazing journey. And it has now become one of the highest tech specialties in medicine and is revolutionizing medical care. So it is only befitting that today we celebrate radiology, celebrate its achievements, and pay tribute to all the great doctors and scientists who contributed to its development. Our chief guest, Dr. VRK Rao, set the tone for today's meeting with an illuminating address. Thank you, sir, on behalf of IRIA Kerala for taking the time to be with us and grace the occasion. Dr. Srikanth Moorthy also is one of the pioneers in IR, and we are very privileged that he agreed to be with us and give us the keynote address. Heartfelt thanks to you, sir, for sharing your wisdom and experience. IRA Kerala chapter is also truly grateful to all the awardees for participating in today's function. It was indeed a privilege to honor their remarkable contribution to IR. Conducting and orchestrating a function and attending to all the nitty-gritty details takes a lot of time and effort. Many thanks and kudos to all the IRIA office bearers, to Dr. Jassim and all my colleagues who helped to coordinate and conduct this wonderful function despite their busy schedule. I also extend my gratitude and heartfelt thanks on behalf of IRIA to Archana Associates for sponsoring this program. This function would also not have been possible without the able support of the technical team. So thank you to Dr. Neha, Dr. Bhageshri, and the entire VDoctor team. Also, special thanks to all my esteemed seniors who enthusiastically participated in today's program and helped to make it a grand success. No IRIA function would be complete without the charming presence of Dr. Judy and Dr. Avni. So thank you for being such talented and wonderful MCs. Thank you both. It was also heartwarming to see the overwhelming attendance in today's program. So thanks to all the delegates for joining us and celebrating International Day of Radiology. As for me, for my part, I consider myself really proud and privileged to be part of radiology, which has contributed so significantly to medical care. And also in these COVID times, it rose superbly to face the challenge of the COVID pandemic. Let us this day rededicate our efforts to making IR and radiology much more widely available, accessible, and help it achieve even greater glory. Jai Hind.
Thank you so much, ma'am. Dear all, this brings us to the close of the program. I thank you all for your active participation in this event. And wrapping it up, good night to all.
Take care and stay safe.
Good night.
Good
Thank
night.
you.
Thank you.
Thank you all. Thank you.
Thank you.
Night.
Night. Good night. Thank you all.
Good night.
Thank you, sir. So with the permission, may I end the session?
Yeah, please, please.
Thank you, sir.